Welcome back to the Dementia Collective. Today, we have the pleasure of being joined by Dr. Haidong Liang. Dr. Haidong Liang is a dedicated gerontologist who earned 3 degrees in aging studies in Canada and seamlessly bridges academic research with real-life practice. He serves as the CEO of Westend Seniors Activity Centre and We Seniors Strathcona County. Using the innovative We Seniors platform, his organization founded the Alberta Seniors Alliance, supporting multiple organizations in the Greater Edmonton area by connecting underserved seniors to services provided by the public, private, and nonprofit sectors. His work has been recognized with awards such as Edmonton's Top 40 Under 40, the Minister's Senior Service Award, the Queen Elizabeth II Platinum Jubilee Medal, and the King Charles III Coronation Medal. Under his leadership, the organization also received the 2019 Minister's Senior Service Award, one of only 2 Alberta recipients. And he was the sole Alberta recipient of the 2025 Healthy Aging Impact Award, Heart of Community Collaborate Award for exceptional leadership in building collaborative community partnerships. Today, we're excited that Dr. Liang's appearance is in conjunction with Podcastathon 2026, which is the world's largest charity podcast event. The Dementia Collective has decided to support We Seniors as our charity of choice and are excited to share how they are supporting elders, caregivers, and the Edmonton community. Welcome, Haidong. Thank you so much for joining us today.
Well, thank you, Andy.
So we start every episode with a Patreon question. We have members of what we call the Village, and they are Patreon supporters who help us bring the show to life. And they get asked one question to the guest. One of the Patreon members wanted to ask, what do you say to families when the person living with dementia resists activities, doesn't want to go to any sort of support programs, and they just want to stay at home?
If in that case, then I'm going to say to the person, really, what's best for yourself and the family? I'm actually going to ask the people that question. Like, what is best for your family and the person who you love the most? Because at the end of the day, it's all about choices, right? Like, a lot of time we don't know what we don't know. So we just thought we're doing something that is best for the person we love. But in this kind of situation, I think kind of like link back to my organization's platform, the We Seniors. We Seniors stands for We're All Seniors. So that includes family, friends, neighbors, caregivers, anybody who are interacting with the seniors. So kind of like looking at it in that angle, what is best for all of those people, right? And there are many other options that is there for people to actually have a quality life. And lately I was being interviewed to do a kind of like to talk about aging with dignity. I think that it's something, we could probably explore. I mean, there's no fixed answer for that one, but what is best for everybody who's involved in that situation?
So how would you say that somebody would age with dignity? Like, what does that mean in your context?
Well, aging with dignity. So, I mean, imagine when they age, right? Like people always believe that age is a disease. Or many people believe that. And they have very negative opinion about getting older. And quite often we say, people said like, oh, I just hate getting old. And then aging is a disease, and then I don't want to get old. And then we're talking about abuse, talking about stereotype, talking about ageism, all that kind of thing. But really all comes from because people are so afraid of aging. So how can we get people to like not to think that way? It's the time when people see that when they get older, they can age with dignity. So dignity in this case is that like, okay, do I still have quality of life? Do I still have social connection? When I need help, do I have somebody who I can call? When I feel alone, is there anybody that I can talk to, that I can go to, go somewhere together? Of course, in your situation, like the thing that you're talking about, people with dementia, I mean, scientists haven't really figured out what exactly those patients think and feel when they're in that situation, right? So it kind of depends on us to make, like, the caregivers to make assumption, caregivers or family to make assumption, and then what we felt like, oh, aging it with dignity, yeah, we're gonna look after them, make sure that they dress properly, they eat properly, uh, help them clean. Yeah, no, that's one way of aging with dignity. But at the same time, what are the what was the conversation that we should have before uh, those people get into that situation? People should have options, and people should make decision about what their life should be.
I think it's a interesting point that you mentioned specifically that, let's have these advanced conversations and um, rather than when it's too far gone, then they may not necessarily have the full cognitive functioning capability or ability to make the decision of this is what I want to do or this is what I want to do. To have those advanced discussions and really find out what's important to them early on, right?
Yeah, I think the reason why I said that, kind of give you some context. The reason why I said that, as you know, I mean, you and I know each other. So, my father passed away in 2023 because of COVID, right? It happened very fast. And then within days, he was into the coma situation. So pretty much he was in ICU for 162 days. For the whole time, he actually woke up once in the middle. And then the first thing he said to us was, I want to go home. Um, but unfortunately, I mean, even right now, I don't know. It's a very mixed feeling. Do I regret? Maybe. But my family, even my mom, still nowadays couldn't get over that, because she felt that she should have respect my father's request. And really, at that time, he couldn't really make any decision. He can't even make decision for himself, right? And then finally, just like that happened. So I felt like, although uh, he wasn't, um, he passed away not because of dementia, but I kind of felt like I'm in the same kind of situation. It's like, okay, if the loved ones is in the dementia later stage, like, what should I do? Right? Like that kind of thing. But one thing I know for sure, I tried to discuss with my father, but because of some kind of belief, it's almost like superstition type of thing. And then he believed that talking about that kind of stuff is just bad luck. So he refused to talk about it. Right. So stuff like that probably could apply to this situation as well.
So can we take a step back, Haidong? So
Yes.
you have a PhD in gerontology. What led you to that space?
Well, again, I mean, I was talking to my father, right? So he was actually the reason at that time, in 2002, before I came to Canada. He said, well, what's gonna be the future, right? So for him, as a visionary, he said aging is gonna be the future, and also how to help aging population live comfortably, happily, healthily is one of the topic. And that was the reason why I also chose physical activity, kinesiology, recreation management as my major, and then gerontology as my minor. And then I continue with that journey through my master and PhD degrees. Yeah.
Were you heavily involved with any elders or seniors growing up that really um, helped you understand the significance of that field?
Well, I wouldn't say, like, a lot of time people try to say, well, is it because you grew up? I mean, I know you are, and then I know, I mean, many people grew up with grandparents. I wasn't really like that, but I think one thing was because my parents always um, taught me to respect other people. They, especially the older person and the younger person. I guess that's kind of like in my culture in a way. And then I guess they taught me well. So I wanted to show that kind of respect to people, for older people at that time. I mean, to be honest, I wasn't. I guess I'm a good kid. I'm a good boy, and kind of like listen to what father said. And at the beginning, nah, whatever. Yeah, aging, gerontology. Yeah, sure. Let's see. Right. I never really expect that I will go this far, but then the more I'm into it, the more I said, "Wow." That's why right now I'm the biggest advocate for aging studies, for gerontology, and I think it has so much potential in every single aspect.
Your dad got his PhD in gerontology too, didn't he?
No, 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 no. He actually he and my parents both graduated from the best university in China, like a Beijing University. So I mean they're highly educated, especially in at that time of China, right? Like they're one of the very rare families that have two extremely highly educated persons. So no, they never really go for the went for the PhD or master, but they're very smart people. Yeah.
So how did you get from China PhD to gerontology into We Seniors? What was that journey like?
Well, I mean, I was collecting data for my dissertation at the Westend Seniors Activity Centre, and then at that time, one of the managers here said, "Well, if that's your background, why don't you help us to create something?" And then I said, "Okay." I look at the recreation program that they were doing, and then I was like, yeah, I think we could do something. So ever since we started the program, applying all my recreation management type of, I guess, knowledge, and then creating a lot of programs. So yeah, I'm actually still quite proud. Like within a year, we increased our program from one page, double sided, that type of program, to a booklet with over 100 pages. Like so we increase our programs substantially. And like yoga activity, as for example, it was only one. Then within a year, there were over 14 different kinds of yoga classes being offered in the building. And then the membership, and then the just everything else started growing substantially. And finally, when I became the ED, executive director of the organization, I guess I'm very fortunate to have a board to support me, and a very strong staff team to support me, and yeah, allow me to build this We Senior platform. And yeah, here we are. And yesterday at the Strathcona County, we're celebrating the third anniversary there. Like that is our satellite location, and now we're expanding all over the greater Edmonton area. So yeah, it's been a very, I would say, fun journey.
How many seniors are supported by We Seniors?
Well, so as I mentioned briefly, We Seniors right now is actually is a brand. Okay, so we just get our registration from Alberta Registry last year. So we're rebranding as We Seniors. So under We Seniors, we have the Westend Seniors Activity Centre, which is the headquarter. So in this location, we're offering over 100 different kind of programs, registered programs, online, in person, drop-in activities, different information sessions, events, all that kind of thing is over 100 different kind. So our membership is close to 2,000. We're
2000 in just the West End.
Yeah, and it's like we open Monday to Friday. We're one of the very few organizations that open in the evening, so Tuesday, Wednesday, Thursday night as well. And we're very lucky to be selected as I would say, the only organization that's providing senior support for Strathcona County since 2022. So the county is very happy about our performance, and then they're extending our contract there. And also under We Seniors, we have another thing is called the Alberta Seniors Alliance, which was established during the um, uh, pandemic. So under that umbrella, Alberta Seniors Alliance, Westend Seniors Activity Centre, as the founder, it's supporting 8 different other organizations through funding, through administrative support. So together, I would say it's going to be a very conservative number because in Strathcona County, we're not taking membership yet. But based on the report and based on the statistics and based on the impact, yeah, I would say at least we're support together. The platform is supporting over 10,000 seniors in the greater Edmonton area.
Wow. And they come from all walks of life, backgrounds, cultural identities, religions. You're able to support them how they need it across the spectrum, right?
Yeah, so pretty much what we believe is that we're just here to support, right? Like we don't want, and we believe in partnership, and we don't win-win partnership. We don't felt like many people felt like we're trying to take over. No, like once they see how we support those organizations, then they know. Like if you want to take over some organization, why are you giving them so much funding, right? So we're the only organization in the Greater Edmonton area that received the federal funding, the Pan-Canadian New Horizon for Seniors funding, over $2 million. And then we're dispersing money to 5 different organizations. So if we try to take over then, right, like what's the, like, it just doesn't really make sense. But so we're acting more like a backbone organization, helping those organizations to grow their capacity. We duplicate our template there. Of course, we'll customize it and then help them to reach out to more people. And then jointly, if we have anything, for example, like something to do, for example, with you. So if you have something that you feel like you can benefit more people, when you come to me, in the past, maybe just Westend Seniors Activity Centre, but now I can confidently say, hey, Andy, if you have something you want to promote, come to me, and then I will share that within Westend Seniors Activity Centre, share that in Strathcona County, talk to our 8 other organizations and say, hey, BlueBell has some great product that is beneficial for people with like dementia, right? Like stuff like that. I believe that is what we call collective impact.
Mm. And I think that speaks to the partnerships that you guys have. I mean, I think great example of this is um, the Silvertech Summit that happened in the
Yeah,
fall. I think
yeah,
that's a great example where um, elders themselves, as well as innovators, organizations, were all able to come together and uh, collaborate and cohesively work towards a vision of um, supporting seniors where they are, making sure they understand how the technology fits around them and age with dignity, as you mentioned earlier.
yeah. Yeah, and then last year we were the only organization across Alberta that received the Heart of the Community Award, which recognized the organization that is showing leadership in collaboration. So I guess that kind of speaks for itself about like what we believe and what we do, right? So
So, Haidong, if a family member was to say, what is the value proposition towards becoming a member in something like West End Seniors, what would you say to them? What is the value of being a member and engaged and building that connection?
Okay. Thank you, Andy, for asking that question. Actually, to be honest, I'm more than happy to actually sell our membership. But on the other hand, I think that's not what we senior believes. Really, if you look at the what we do, many of the eight organizations that we're supporting and the community league churches and elementary schools that we're supporting in the West End area, none of those organizations were requested to purchase our membership, because what we believe is that membership is, yeah, of course, when you become a member, you have the advantage of taking being the first to take the classes in our organization, right? So of course we welcome that, and then uh, yeah, it definitely it comes with some perks, right? Like, so for example, you could get special discounts from different businesses, partners, that kind of thing. Well, it's the typical marketing or promotion type of thing. But what we believe is actually not about you becoming a member. For example, we're providing support to a senior's home every week. We're setting up an outreach clinic there, and then we're bringing our frozen food there, and people purchase, people in that building purchase food from us. But our outreach worker would take the food there and stay there for half day to answer their questions, to help them to deal with a lot of issues. Are they going to become our members? No. Right. And then we have a lot of online classes, and people are taking classes from pretty much across Alberta. And some people living in like southern Alberta taking our classes. Do I really ask that person for membership? No. What we believe is that if we could we could help them to combat social isolation. That is what we seniors is about. Otherwise, I would say, yeah, no, I'm more than happy to like attract membership, but kind of like everything we do, a lot of things actually what we do is even free, right? Like in Strathcona County, yeah, there's no membership. People come and people wanted to get support. We help them. We help them to address problems. I don't think like really membership defines the organization. Yeah, as long as you are a senior, whether you're a member of the other organization or not, if you need help, if you need support, come to us, and that's what we're here for.
What is the impact that you've seen on um, aging and cognitive decline in general with respect to activities?
Well, I mean, you and I both know, right? I mean, like you are a crazy guy doing all that kind of like a marathon and triathlon, that kind of stuff. I mean, like I can't even do any of that. But you know that I'm also the
You
guy.
and I will. We will, Haidong.
I know, no, but I'm the person who, I'm the guy who love exercise, and I have been exercising over 1,200 days in a row, right? Like for the past 3.5 years. So, I mean, exercising, a lot of time people say, well, it's just, yeah, it's personal hobbies and people love it or whatever. But really, from a scientific perspective, if you do exercise, you're going to be smarter, and you're building more neuron connection in your brain, and then it's actually a very proactive and preventative approach to not to prevent or cure, but to delay and improve the cognitive decline, right? And also a lot of time, and based on research, we all knew that, right? Like why? Well, for people with dementia, like there are computer games, there are like the partnership with the University of Alberta, right? Like some of the stuff that we're doing is try to stimulate people's brain. But actually the easiest way is to do activities, any kind of, whether it's a physical activity or art, craft, like creative type of activity, right? Anything, or even social connection, like chatting with other people, like anything that it's able to get your brain thinking. Because as I like, sometimes you and I are in that kind of people, right? Because we're so busy. And one thing, what we feel relaxed, uh, besides recreation as an activity, is actually just blank, like thinking blank, right? Like we just want to rest our brain. But that's for people like us. But then when our brain is blank too much or resting too much, wow, our body will just like when just not feeling right? Like we felt like what's wrong with us. But I think the enough research to talk about it, to prove it, and like we just need to make sure people help people. Some people really, they just say, I don't like activity, I don't like exercise, I don't like social isolation, I don't like social connection. But there is something for everyone. That's what we believe. Yeah.
So, what sort of activities for the listeners do you guys offer?
Anything you can think of. I would say we're almost always, the way that we describe our organization is that we're more like senior high school. So classes like the cardio exercise, resistance exercise, and then like all the other activities such like pickleballs, like badmintons, and then we have walking club, and then of course creative program like ceramics, drawing, painting. Like we have workshops for people to make stuff, to create stuff for the uh, school, for the church, like different kind of stuff. And then of course volunteering, that's one thing always people forgot. That's a very meaningful activity. So we have seniors who are knitters and artists. They're helping us to go to the uh, elementary schools to teach those kids classes, right? Because nowadays, I mean, our public school system, a lot of time kids don't have enough resources to take that kind of classes. So our volunteers are going to those schools to offer free sessions, right? So activities, just any kind you can think of. And like yesterday, in our third year anniversary in Strathcona County, one lady actually came to me. She said, okay, I have a health issue, and I know in seniors, not a lot of seniors will have this kind of disease. But I felt like we want to form a support group. Can you guys help us? Okay. I mean, I don't know the health issue. I don't know the diseases. But the person came to us and say, "Can you form a support group?" Sure. So you initiate it, we support it. That's kind of like how we create that kind of program. So now we have men's shed, we have widow support widows, like so widow to widows, that kind of like a program, peer support program, right? So anything you people think of, and then anything that they need, come to us, and if we're able to offer, we will. If we can, we will find the organization that can offer for those people. Yeah.
So, we've had multiple people on the show talk about um, policy and systematic barriers in Alberta specifically
Mhm.
regarding seniors. And I know Dr. Sharon Anderson specifically mentioned that we are going to be seeing more individuals living at home being cared for by their families rather than within institutional care. How do you see an entity like We Seniors um, supporting families as the care needs grow over time?
I think that's, again, going back to the concept I introduced at the beginning of our platform. It's called We Seniors, right? So We Seniors, again, our mention that again here. So We Seniors stands for We're All Seniors, because seniors social network involves family, friends, neighbors, caregivers. So as you see, I emphasize caregivers. Of course, caregivers a lot of time includes family, friends, neighbors, right? But also some professional people. And that's also one of the reasons why right now in Edmonton, especially after pandemic, you can see how many home care company all of a sudden just like overnight show up, right? So, I mean, there is a huge need. And Dr. Sharon Anderson, I mean, and also Caregivers Alberta, those are topics that we've been really talking about, and aging, like how to, and the federal government's emphasis is also on healthy aging at home. So, what organization like us, what we believe is two things. One is seniors don't know what they don't know. So how can we help them to know what they may need? Right. So that's one of the reasons why our organization is doing two things. One is called the Healthy Aging, Active Aging Series. So we're inviting experts and inviting senior serving organizations to come and do presentations. For example, people like you who are the expert in dementia care, we will invite people like you to come and do presentations and share with people, okay, what should you do, right? And our active aging series has been very popular. So we're talking about different kind of thing, not just people sometimes they say, well, that's the sad thing to talk about, because we will talk about funeral, we'll talk about preparation, we'll talk about estate planning, we'll talk about like kind of like afterlife care, all that kind of thing. But those are needed. But on the other hand, we'll talk about something fun, right? Like we'll talk about, okay, maybe after you get older, how should you enjoy life? For example, we have active aging series talking about women travel solo, right? So we'll bring pharmacists to come to talk about what kind of needs, what kind of medication should you bring when you travel, and then we'll bring liquor store to come and talk about what kind of wines you should enjoy when you're on a cruise ship, right? And then we'll invite travel companies or platform like Expedia, that kind of companies, to come and talk about what kind of tricks and tips that they should learn to enhance the experience their travel, right? And of course we'll invite businesses that doesn't even sound like relevant. For example, painters. We'll invite people who are electricians, plumbers, to talk about things. And then people say, well, why do I need to know that? Well, yeah, actually, if you want to live healthier at home, you do need to know that, right? So sometimes people don't feel like I need that kind of stuff, but we need to prepare. And we always say, you may not need it right now, but remember, when you encounter that problem, you know, and you are prepared where to find the help, right? And then the second approach that we're doing right now in Strathcona County is actually called the Roadshow. So a lot of seniors are living in the remote and rural areas. How can they access to the information? None. Really, and also in their local area, they don't really have that many stores. So quite often they have to travel all the way to the uh, metropolitan area, like Strathcona County. Many seniors have to drive about 30, 40 minutes to Shore Park. Like Strathcona County is just so big, right? But what we've been doing, and we are doing it this year with the funding support from Edmonton Community Foundation, we're going to do 3 rounds of roadshows. So last year, because of that idea is so successful. So what roadshow stands is that we actually will go to different hamlets and rural communities, bring programs, bring presentation, bring mini trade show. We'll serve the barbecue, a free barbecue, and then the county administration, like Parks and Recs, RCMP, library, um, like um, businesses like the local seniors homes or health home care companies and pharmacies, like those businesses will come with us to that location. So we're bringing that kind of stuff to them. I That's why what I believe is that if we want to show a model that is sustainable, that's uh, not just one time thing, and then we're hoping to demonstrate the impact, which I mean the impact in Strathcona County was huge. Last year we were being featured on the news so many times, and then we want to work with the local government, and then we want to tell the government from all three levels, federal, provincial, and municipal, is that there are cheaper ways. Oh, well, I shouldn't use the cheaper, the word. I should use more effective and cost-effective approach to deal with some of the issues. Like quite often, our government might think they can deal with those issues, but I mean, Andy, you know that, right? Quite often we said, let the professional do the thing. So we're the professional, we know what we're doing, and then if the government any people happen to hear this podcast, and I hope that reach out to us, and we have many successful examples and template we're more than happy to share.
So, what gaps are you seeing between what seniors and aging policy says versus what seniors themselves are actually needing or looking for? Is there any gaps in that space?
Well, I mean, I think that's why I said seniors sometimes they don't know what they really need, right? Like when you do the interview, when you do the thing, they just say, "Oh, I need this," and quite often the only thing they say, "I need more money," right? Like they say, "Well, let's just they say, "Oh, we need more service, we need more money, we need more this." Okay, in what way? I don't know. We just need it, right? And then I mean, policy from a theory standpoint says, yeah, let's accomplish healthy aging or aging at home. But what does that mean? Right? Like quite often some of the policy makers, they are I mean you and I both got PhDs. So a lot of time I guess the stereotype is that we only know the theory, but we don't know how to apply the theory in the reality. So luckily we not only know the theory, but we also know the reality. So we're there to bridge that gap, right? So we want it to be that bridge to help the government understand your intention of the policy is great, and but sometimes it's not realistic. And then we're there to also help seniors know that, okay, you don't know what exactly you don't know, but we're here to help you to understand, okay, what aging looks like. What do you need to do and learn and prepare for healthier aging process? Yeah.
What I've seen a lot is the policy and government process is really this objective blanket approach that says we will do this thing that's going to be good for whatever 80% of people, and it is going to be a standard approach, and we will apply it the same for everyone. But you have these people on the side, they're like, that doesn't necessarily work for me. I need it in this specific way. And they're kind of left then holding the bag for themselves, trying to figure out how do I get support when the support I'm given isn't reflective of what I need. And what I'm hearing by the supports that y'all are offering is whether it is you need support for getting meals, you need supports for some physical activity things, you need supports for awareness of health outcomes. It sounds like you're kind of filling in that spot that is oftentimes ignored by the blanket vanilla policy approach.
Yeah, I guess we're going back to the scenario that you were talking at the beginning, right? So if a family is dealing with their loved ones who have dementia situation. So in that situation, whether it's at the beginning stage or in the later stage, really the kind of support that they all need is a wraparound support, right? So we need to look at each person who's involved in that scenario, right? So for example, for the caregiver, you can't ignore them. You can't just say, okay, yeah, okay, you're not a senior, so yeah, whatever, right? Because if we look after that person will look after the loved ones, the one who has the dementia, right? So really for us, yeah, we have an age cutoff. It's like 55 years old to become a member. But really, if you look at the population that we're serving, we don't have age limit. We believe it's a wraparound support. It's something that like we need to do, like as a serving organization, like a aging, I would say healthy aging senior serving organization. Yeah.
From a seniors activity center perspective, how do you guys engage with those living with dementia? What is the process like?
Okay. So again, coming from multiple aspect. Okay. Um, First, I will talk about the day to day. Okay. So our building actually have a tenant organization called the I'm gonna advocate for them as well. Is called Elder Care Edmonton. So they're the people who they provide therapeutic recreation program, day program for people with early onset of dementia. So of course, when it comes to that kind of program, okay, we don't really interact with them that much, but our front desk and the staff right away. I mean, we know that when those people walk into the building, right, we're gonna contact their staff. But when their staff not getting to the front door yet, we will be there just to support them until the staff show up, right? And then we're the organization that's actually customized their lunch for them. I mean, trust me, it's very heavy job for my kitchen. Okay, so our kitchen every day have to prepare about 20 different kind of meals to meet 20 different clients special needs, right? Because each of them have different needs. And those 20 people are not coming every day. So technically, Monday to Friday, every day are 20 different people. So you can imagine, like, that's the kind of thing that how can I say, we're supporting. And then when we have events, especially music related events, we will invite those people come and join the activity, right? So it's kind of like adding some extra flavor to their life. So that's kind of like from the program level. From the organization level, so we work together, co-apply for funding, co-fundraising. We did a commercial for them as well to expel the myth of what elder care does, right? Because a lot of time people believe like going to elder care is just like is almost like going to a hospital. So there will be just IV, people are just injecting IV, sitting there doing nothing kind of thing. No, actually, if you go and see them, see the program, therapeutic recreation program that they're doing is amazing. Like it's a lot of fun, right? And we are also providing support to their staff so that their staff and the space for their staff. So when their staff need a space to take a break, right, they can always come to our other office or the open space to take a break or that kind of thing. So that's from like a client level, from the organization level, but also our organization currently is working with two universities actually in the past it was like more than that, but some of the program already finished. So we finished one program with Western University in screening dementia screening tool. Like that's a project back in 2024. And then currently we're working with the University of Montreal and the Brain Institute there on a dementia prevention program. And with the University of Alberta, computing science, like Dr. Eleni, Professor, the Associate Dean, like Eleni, is doing 4 different kind of projects with us. For example, how to use virtual reality to stimulate those patients or clients' brain. And also they're creating computer games, easy to play computer games to stimulate people's brain, help them delay or regain some of the functions. So yeah, we're pretty much everywhere, like just trying to do that kind of thing, and of course partnering with you, right? That's one big thing that we wanted to really address this, because you know the stats. I mean, it's scary.
Do you ever see, um, say, members that are not going down to the basement of the facility? Do you ever notice that maybe their cognition is slipping, their recall is not as sharp as it was? So how do you address that when you or your team start to see, like, I'm starting to notice there are some indicators here that could be indicative of um, a dementia or some sort of other cognitive impairment? How do you address that? Because I would think that if you bring it up to the person themselves, it might be alarming. It might cause stress. And we've had people on the show before here where they talk about the journey of it, and they recognize they have some of these instances that they've done this, but they're also rejecting the idea that they have this cognitive impairments, and they'll push back. So how would you address that, or how do you address that?
I would say 3 aspects, right? One is like the research study that I just mentioned, right? So the reason why those universities want to work with us is because we've been helping so many universities across Canada to collect data. Where our name is on so many research paper, right? Because our people, they know this center is giving them that kind of opportunity, so they can self-check. Like one example is nothing to do with dementia, but it's with heart-related problems. So one of the doctor came to our center, and then through a very simple approach that day, about 45 participants, 5 of them detected heart problem, which they were not even aware of. And right away, they were like, holy mother. So they went to the hospital right away. They said, okay, we're going to get this checked out, right? Like, so awareness, right? Like, that's why I said active aging series, all that kind of thing, research study, right? Like, we want them to be aware of, right? And then the other thing, the second approach is actually when we identifying those, right? Like our organization has something, we have the outreach department, so we have social workers. So confidentiality and respect people, helping people age with dignity, it's our key priority, right? So if our if our social worker, our staff, any of staff or volunteers identify problem, let us know, and then our social worker will intervene. Our social worker will like, okay, let's find a way to see, right? Like if the person wants to talk about it or whatever, right? Like, and then we're gonna find different approaches. So, for example, we will even use the opportunity. Let's say the dementia screening tool, right? Like we'll just say, hey, can you help us to like do a research study, right? Like so, kind of like a collect some data kind of thing. And this is a tool that we'll like to use, and then like, can you help us to fill out this survey or that kind of thing? And then the person, we kind of like wanted to let the person be self-aware kind of thing, right? Then of course, the third approach is actually we all, for our members, that's kind of tied to what you said regarding the benefit of being a member, is that if you're a member, you do need to provide a emergency contact number. So we talk to the person surrounding that person, right? So we say, okay, can you guys keep an eye on the person? So quite often it's their adult children, right? So we'll talk to their adult children and say, we notice your father or your mom had lately showing some signs, and then if you need any help, you know where to find us, right? So that's the kind of thing we'll do. So 3 different approach. So it's very soft. It's from a very gentle angle to address it. So even when we need to address it, we're ensuring the privacy, like confidentiality. Like we're staff knew that, right? Like if the client enters into our social worker's office, nothing in that room should be shared and disclosed. Whether that person has symptoms or not, or whether that person has issues or not, no. Like other people don't need to know except the social worker. Yeah.
So, you guys exist in multiple locations and serve multicultural individuals, right, from diverse background. How does how do you adapt and adjust the programs to reflect the needs of the specific multicultural community in which you are serving?
Well, we learned lesson from before. We actually brought people to our building, and then we felt like, oh, they're gonna acculturate it or assimilate it into our culture here, the mainstream culture and mainstream programs so nicely. No, it was a failure, and it's creating distress to both sides. So we quickly abandoned that approach long time ago, like since 2013, when we were uh, funded by the city of Edmonton to create program for the Africa Center. That was a very unsuccessful project at the beginning. But then after we realized the problem, we just said, well, you know what? We're not going to force people to go into a very uncomfortable approach places, right? So that's actually one of the reasons why we help many of the local ethnic groups to start their own nonprofit organization. And when they start their own nonprofit organization, then that's the time that we, as a 47 years serving, 47 years old serving mainstream charity, we're able to lend our specialty and expertise in, for example, grant writing and also administrative support to them. Many of the grants um, will say to those grassroots organizations, sorry, you're not eligible to apply unless you're able to find a well established organization to work with you, right? So that's one of the reasons why we formed the Elder Seniors Alliance. So we're helping a lot of those grassroots organizations first establish their own organization. Then we help them with, for example, bylaws, policies, volunteer manuals, all that kind of thing. Help them to start getting some grants, and some organization now even could get casino money. So they hire their people, they hire people who speak their language, they design program that's suitable for them. And then we're able to bring those group back to our center for things like volunteer appreciation. So then like the past 5 years, it has been like a joint volunteer appreciation, right? Like from multiple organizations. And then we'll do Christmas events, we'll bring those, and then they will come and do the entertainment for us, the singing, dancing, all that kind of thing. Wow, saving money for everybody. So kind of like a win-win, right? So that's we believe is that like from a how can I say, capacity building aspect to support those organizations. Otherwise, just there's no way it's going to be just one-time help. Mhm.
So, Haidong, let's shift to a round that I call lightning round. You ready?
Yeah.
Coffee or tea?
Coffee.
Morning person or night owl?
9.
What is the biggest change you see when someone starts participating and engaging in your programs?
Smile.
What do families notice first when your engagement is working?
Happiness.
What's one activity that surprises the families the most that works?
Pickleball.
That's one I need to get into. I hear so many good things about it.
Yeah.
Where do families unintentionally hold seniors back?
Love. Well, that's one word, but is it just one word or a phrase?
Phrase, if you want a phrase.
Well, control in the name of the love.
What's harder, starting an activity or keeping them going?
Starting.
What do people misunderstand about keeping seniors active?
We're old. The belief, misconception.
And what would that misconception be specifically?
We're old, and aging is disease.
What matters more than the activity itself?
Social connection.
What's one thing you've seen caregivers doing right without realizing that they're actually doing it?
Well, that's a hard question. Doing right. Well, love, unconditional love, I would say. Yeah.
When does activity stop being helpful?
Not happy.
When they're not happy?
Well, when you don't feel the joy of doing it.
What's the most human thing that's happened to you lately?
An instant help from a stranger when I injure myself.
What gives you the most hope in this work?
The increasing population.
Fair enough. Haidong, I always leave the guest with the opportunity to make the last comment, statement, whatever it is. You don't have to exist within that one sentence range. You have the platform. So, what would you say to the listeners?
Well, of course, I mean, like it sounds like polite or polished, but like thank you, Andy. Like this is a great platform, so thank you for having me. That's one thing. So going back to your question, I would say to the audience, and also hopefully your audience include the politicians and practitioners in the field, or anybody who are doing anything else that are not even relevant, right? It's like aging industry. It's an untapped diamond mine. It could be the next economic engine for Edmonton, for Alberta, for Canada, if we do it right. Because I don't believe, I mean, when it has the benefit, when it has the uh, potential of the, whether it's profit or money or something else, any benefit it's people can get, that's where people will start investing time, investing money, investing effort, right? Like right now, people just seeing this as a very negative way. I think I said one sentence long time ago in one of the presentation. I said, aging industry, people don't think is a sexy industry. but I think it is, and it's an untapped diamond mine.
Yeah, true. Well, Haidong, thank you, my friend, for joining us today on the episode. It was really inspirational to hear how you're impacting not just policy, but the lives of seniors themselves. So thank you so much for joining us.
Thank you.
To our listeners, thank you for being here as well. If today's conversation resonated with you, make sure to follow the Dementia Collective wherever you get your podcasts. And don't forget, share this episode with someone who you think might benefit. And if you'd like to help us grow this movement, please consider becoming a member of the Village on Patreon. Among the benefits, like the ability to ask questions to our guests, you'll get early access to every episode, plus the satisfaction of helping powerful voices like Dr. Liang's reach more caregivers around the world. And finally, if you're on your own caregiving journey, remember, you are not alone. We're here at BlueBell to help connect you with the supports and resources that truly fit your family's needs. Until next time, remember, you are strong, you are not alone, and you are doing something that matters more than you know. Until next time.